Hi, everybody. Welcome back to the Slimming Surgeon podcast. I'm your host, Dr. Kandace Kichler. Today on our show, we have a very special guest. This is Dr. Andrew Berry. So he's a longtime friend of mine since residency, basically. He's currently a concierge board-certified gastroenterologist. He's the practice owner of The Modern Med. To summarize his impressive 29-page CV, I will let you know that he is extensively published with over 40 peer-reviewed articles, as well as a regular highlight on both online and visual media publications for his work in gastroenterology, COVID, and patient care. He completed training through the University of Wisconsin, University of South Alabama, Kansas City University, and Larkin Community Hospital in Miami. So he is absolutely an expert on pretty much everything we're going to talk about today. Welcome.
Thanks for having me.
All right, so I'm just going to get right into a bunch of questions that I gathered from my audience that I'm personally interested in, and you just tell me your thoughts. Feel free to be as scientific as you want or as kindergarten as you want, because I think we're all here to just learn and engage.
Sounds good. We'll do both.
Okay, cool. So let's just define, what is gut health? Like, when you hear that, does that make you cringe, or is it a real thing?
It's a real thing. It's very vague. It's something that varies depending on who your audience is, in the academic scientific community, or your typical person that's, you see at work and your family members. Gut health really means, to me as a doctor, but also as a person, means an interaction between like your brain and your gut, not just your actual stomach. We're talking about your gut. When I say the word gut, it means stomach, colon, small intestine, all the above. I think there's a huge connection, especially now versus 10, 20 years ago, this whole brain-gut interaction or axis, gut-brain axis, GBA, you might hear that. So basically your mood and your anxiety, your day-to-day activities affect your gut and vice versa. Yeah, I feel like this is something that's like newer that people are starting to really talk about, but we've been damaging our guts forever. And I think it's really affected a lot of people, like mentally, personally, psychologically. And the food we eat plays a huge role in this, right? Huge. I mean, common example is you're traveling and everyone just feels different or off when they're traveling. No, it's not always just alcohol or something. Even if you don't drink, it's just the food. It actually does matter, the food that you eat, where it's grown, how it's grown, as you see with all these organic foods. What does that even mean? It does matter. And, flying on an airplane, altitude, you get constipation or just different symptoms that you don't get in your Monday, Tuesday, Wednesday, Thursday routine. So I think there's a huge preponderance of research toward that these days. And it's not just GI. It's actually the best research comes from non-GI specialties, such as neurology, psychiatry, anything, honestly, even OBGYN related. So why, or what are some ways that people could optimize their gut health? Like, is there a supplement we should be taking? Like, should we be, counting macros? Like, in general, what do you think are good ways to just keep it in check? Valid question. And honestly, it's an answer that not you, but your average listener might not want to hear. It's not a pill. Yeah, right? We all just want a pill. Just give me a pill. Should I just take a probiotic and it'll fix it? Exactly. Even as a doctor, we've all thought that and maybe tried it. Yeah. But I don't take probiotics anymore. I used to, but yeah, I take other stuff. There's, the literature lags behind reality, as we've all seen with the COVID stuff. The studies are still coming out now from 3 years ago because you need randomized control, all the above. So, probiotics, prebiotics, they are different. Prebiotic is kind of like a food that feeds the probiotic. Probiotic is an actual live organisms that confer a health benefit because they're not FDA regulated. In fact, I've done some research on this, that's why I know this. The same probiotic that's listed as a brand XY, sold at CVS, Walgreens, or whatever store, depending on where it's produced and the factory is, like geographic location, determines the makeup. So you can buy the same product that's sold at the same place, but it's completely different organisms or amount or type. What? So it's not really, that's why it's not FDA regulated. It confers a health benefit. So that's why the studies are so hard to do because it's not reproducible like, on hypertensive medication, lisinopril, which is lisinopril. Yeah.
Right.
So
It's kind of like
hard.
honey. You get honey from different areas. It's different pollen, different bees, different all these things. So you're going to have a different, benefit when you see it.
Correct. So that's why it's very difficult, even if you, let's say without a doctor, just try certain things, which I am all for, and something works. But if you go like different area of the country, or even just bad luck, it's the next month to get the next shipment, it might actually not even be the same product.
Yeah, that's wild. What about fiber? Like, do we all need to have fiber every single day?
Yeah, so fiber is very important, especially in the Western diet, because we don't get enough. I think the average person in the USA, adult, gets about 15 grams of fiber a day.
Okay.
The recommendation formally is around 25 grams. To give you context, an apple's 4.5 grams of fiber.
Okay.
And high fiber foods are the stuff that you think, vegetables, fruits, but an apple is, let's just say 5, will round up. So 5 apples a day.
Yeah, that's
keeps
a lot.
the doctor away.
Yeah, damn. I definitely don't eat enough apples.
Exactly.
Shoot. Okay. So fiber, probiotics, like, do you recommend like a certain amount of water a day, a certain amount of, like, what are other things that people should be doing that we know that we're not?
Exactly. It's hard to quantify an exact amount because the patient or the person wants that. So then they can fall to that.
I want to put it in my podcast notes. Dr. Barry says 5 apples, 50 ounces of water,
Everybody wants a checklist, like Monday through Thursday, the work week checklist. They want to bring their Stanley and I drink this water. Blah, blah, I'm done, I'm healthy.
Yeah, right.
No. So that's why it's not a good idea for me or you to give you an exact amount. Honestly, what the right amount is more than what you're doing.
Mm-hmm. Okay.
Truthfully. And then honestly, just be cognizant of that and see. Like my theory is if it doesn't work, try something different within reason.
Okay. So what got you interested in GI? Like, did you always know you wanted to be a gastroenterologist?
Not really, truthfully. Just math science, through school, and then just progressed. It's kind of like what you don't want to do.
Yeah. Yeah.
So then it kind of narrows it down. And then you just realize GI or gastroenterology is something that you see and do every day. Because, it's like death, taxes, and you're going to use the restroom.
Yeah.
So it's going to happen. So you think about it, you see it, you do it. So it's like, okay, I'm already halfway to the education.
Yeah, right. Okay, gotcha.
And you get to do some procedures that it's not long surgeries. I like quicker things instead of something super complex, super long, but I respect all that, obviously.
Right. But you also build relationships with people, you've got that perfect blend where you're doing procedures in and out, but at the same time, you build a long-term relationship with a lot of your patients.
Correct. And you see, exactly, like you said, a lot of people, even with inflammatory bowel disease, they're diagnosed at age 16, 18. So then you see them progress throughout their whole life and keep them healthy. But, sometimes you have flares or issues. But you're right, you get a mixture. You're not just treating 25-year-old females.
Right.
You're treating anyone.
Yeah. What's your favorite disease process to treat?
That sounds very cringe.
I know. I know, but what are you most interested, or what do you find to be a good niche or subject of interest?
So my subject of interest is stuff that people don't like because I like common stuff. So why spend all this time on stuff that you see one patient in the whole community?
Yeah.
Granted, it's important, but I want the most common stuff because why wouldn't you want to be good at the most common things?
Right.
So the most common things like acid reflux, GERD, or irritable bowel syndrome, IBS.
Yeah.
So I like treating that, and no GI doctor would say that.
Really?
Well, at least for the IBS.
Yeah. No, I know, definitely the IBS because it's so hard. It's I feel so bad for those patients.
And
it can be tough.
It's true. An average person just walking into doing this podcast has a little bout of gut discomfort.
Exactly. My stomach hurt earlier today.
Exactly.
I was like, dang it. Okay. So with talking about GERD, acid reflux, irritable bowel, who needs an endoscopy, an upper endoscopy? Because I know what that is. I used to do them. You do them. Obviously, you and I know about that. But I feel I've come in contact with so many friends, family members, coworkers lately who have reflux forever, and no one's ever offered them an upper endoscopy.
Yeah. I guess first thing would be define terms. So endoscopy, the average layperson might think that means a colonoscopy.
Yeah.
So like you said, endo means upper, EGD. So so in the U.S., there's not really perfect guidelines in colonoscopy, age 50, but now 45. It's more vague. So that's the problem. It's more risk
what that you have, such as demographics. It's more like Asian predominance. That's why there's strict guidelines in the Eastern Hemisphere versus the United States is more lax. But now there's, depending on what society you read, so that's a problem with scientific literature. It depends on what book or what guideline and what year and
or
who wrote
who's publishing it. Right.
Correct. So, but the general consensus, I like to say like the overall in the last 5 years, because I don't, I'm not up to date in the last, 6 weeks. Not yet, would be, age and risk factors are important. So preponderance toward elderly, white, males, obese, history of smoking, and have chronic years of reflux.
Yeah.
The main definition, to give you better context for that, would be how many years of reflux, and then what age. So it's like 50, 55, 60, or is it like 0 to 5 years of reflux? It's all kind of subjective on top of objective features.
Gotcha.
It's complicated. So like you said, for an endoscopy, I would talk with your doctor.
Yeah. And I think it's important for our listeners to know, like, this is talking about doing a procedure where the camera is going to look inside your stomach and at your esophagus where that heartburn is burning you to make sure you're not developing precancers, right?
Correct.
Yeah.
And we usually see those kind of reflux, kind of Barrett's, kind of esophageal cancer features in those usually male, older, obese demographics. So you kind of want to focus on that. Doesn't mean to rule
Call
out
your dad.
Yeah, exactly. Honestly, that's probably the first place to start.
Yeah. Okay. So that's the upper endoscopy, which, when I was doing bariatric surgery, I looked at it to look for things like H. pylori, like bacteria that you can treat to help prevent reflux or to help lessen the symptoms. And I would look at it just for polyps and things like that. So with talking about that, I didn't do colonoscopies because ew.
Why would you?
No. So that's also something that you do. There's like typical guidelines for that, but like, let's talk about that. Who needs one? Like someone outside of the guideline. Give me an example of somebody who would need one.
So the basic guideline, like you said, would be 50, now 45, covered by insurance.
Okay.
But who would need one would be someone with red flag symptoms. Even like someone like you and I that had rectal bleeding, like mucosal tearing, like you notice kind of your stool's off. That's more than what you'd suggest from like an acute infectious process, something that's more chronic.
Okay.
Or family history.
Yeah. So
I think it's very important to, obviously over 4th of July, to like have a good time, but also maybe ask a couple family history questions.
Yeah, it's true. Because, if your, close family relative had colon cancer at 40, then when should they get their colonoscopy?
Exactly. If it's first degree relatives, so, sister, brother, parent, it's 10 years before they were diagnosed, or at age 40 if it was after that period of time. It gets tricky on when they were diagnosed, if they aged less than 60 or over 60. So there's other fine details.
Right.
Then there's a second degree. We need to get into that. But your intervals it could be potentially earlier and sooner. So instead of like every 10, it could be every 5, depending on that.
Yeah. And I think it's important that we kind of talk about how not big of a deal this is. It's a procedure and it's annoying to do, but it's something that could save your life, right? Like the prep could be annoying, but who cares?
Who cares? It's if you're healthy and you do it right, it's once every 10 years.
Yeah.
I do things I don't like 20 times a week.
Yeah, like exercise. Nobody likes to exercise. Well, I do like to exercise, but you know what I mean? You do hard things.
And that's it. Exactly.
Yeah, right. So like a colonoscopy, you do the prep like a day before where you're going to go to the bathroom a lot, and then you do the procedure, which is sedation. So you get one IV, you go to sleep, you wake up and it's over with, right?
Correct. It's like a half day event. And honestly, a lot of workplaces give you time for this nowadays, especially with the work atmosphere. So you probably have it covered.
Yeah.
And it's usually covered by insurance for screening, and it's easy. And honestly, you doing it helps your family members do it too, because they see you do it.
Yeah. Super important. There's been a lot of like people in the media, like celebrities passing away from stage 4 colon cancer. So I think it's important that we talk about that. And like you said, this is common stuff. Like you want to be on top of your cancer screening.
Yeah, I think it's very important. I could only imagine I'm curious, I thought about doing the study myself, if all the time and effort, which is important towards COVID, very important, was spent toward colon cancer, breast cancer, all other cancers. I can only imagine how many lives we could have saved more. Granted, we still can. I'm just saying time is important to put towards those efforts.
Right, exactly. It's important to get to the doctor. I mean, like our age group, we're in our 30s. I feel like none of our friends ever go to the doctor. I mean, I'm even bad about it. I don't go to a regular like family practice physician every year or annually like we probably should. Like we should be getting blood work. We should be on top of screening things, you know?
I agree. Our generation's more reactive instead of proactive. So I guess we'll talk about it later. That's kind of why I formed a company that I formed, and we'll get to that detail later, just to be more proactive instead of a just traditional reactive approach.
Yeah. No, I don't do anything until it's like, gotta do it.
Yeah. I mean, I may or may not have, certain meds and antibiotics on stack on demand.
Yeah, so. I know. Okay. So I just want to talk about a couple dietary things quickly, because I follow a bunch of like crunchy granola, like vegan, all the things type of influencers and podcasts. And it's like, am I supposed to stop eating gluten? Is everyone gluten sensitive? Because I have heard that before. And I think it's something that's like being pushed out there now, that we need to eliminate certain foods. Is that true? Like, what are your thoughts?
So there's a lot of truth in that, actually. So real quick would be, as a med student, as you know, and the training and all that, I could probably count on one hand how many hours we spent in our curriculum towards nutrition.
Yeah. Like 0.
Exactly. So right. I've already counted, it's 0.
Mm-hmm.
So that's a problem. Mm-hmm. And there's more to that, with pharmaceuticals and all that past this episode. But the main thing is there is something called, obviously, celiac disease, which a lot of people are aware of. Mm-hmm. But most importantly, and probably more prominently, would be non-celiac gluten sensitivity, like you referred to. So that is a thing, non-celiac gluten sensitivity.
What are some symptoms of that?
Very true. It's bloating, gas, flatulence, just kind of like this brain fog that people reference.
Everybody has brain fog.
I have brain fog when I can't sleep well, but that's not related.
Right.
But it is real. And so 25% of people in the United States follow a gluten-free diet, self-diagnosed, like per Google, whatever. They just don't consume gluten, which is fine. That's how you learn. Mm-hmm. So that's how we're learning certain things. So you're wondering like, what's the actual number of people that have gluten sensitivity, like objectively, or celiac objectively? It's between like 1% and 6% from the last time I looked, with like data from the last 2 years.
Right. But you think in reality it's much higher?
It could be much higher. And there's not like a good test, because some of these tests some people are off celiac and gluten and they get the test done.
Yeah.
So it's not in their system. It's not registering. So the lab's coming back negative.
Yeah.
So the first thing I say as a doctor is take this test and don't stop eating bread.
Yeah. Right. Okay. Gotcha. And what about dairy? Like, I feel like dairy gets a horrible rap right now. I love dairy.
Same. So, I mean, thing is, we grew up on that. So just like us, and I guess, not to sound like weird, but like other mammals, non-human mammals, like as you develop, or as all of us develop and get older, we lose that ability to digest, or that enzyme to digest dairy products.
I was listening to another podcast recently, and they said that, like, the lactase enzyme or whatever we have when we're younger, and it tends to just go away with age. Is that true?
It does. So like, the first thing I say is, like, people come in and complain about symptoms and they're older, especially males.
Yeah.
Oh, first thing you do is eliminate dairy.
Yeah.
My answer to everyone that bothers or texts me on the side, hey, what can you help me with this? Is stop dairy.
Yeah.
So maybe they recently traveled to Mexico or something. They feel bad and they swear it's not alcohol. And it's probably not. Yeah. But it's probably like traveler's diarrhea.
Yeah.
But they're still like consuming cheese and dairy and milk. That's like the worst thing. That's like pouring acid in a wound. Uh-huh. So because dairy is a problem because it has to do with the barrier of the intestine. And you don't see changes in the colon usually. So when you do a colonoscopy, you don't see change. It's mainly in the small intestine. Okay. So that's why even with an endoscopy, an upper endoscopy, you sometimes can see changes. Like celiac, you see the small intestine kind of flatten or scallop. And then histologically, you do see the changes for sure. But you do see changes. It's in the small intestine. And everyone is going to be lactose intolerant. It's just a matter of when.
What? This is horrible news. Yeah. What can I do about it? Take those stupid pills?
Yeah, you can take it on demand. Honestly, enjoy your early years.
Yeah, right. Okay.
But honestly, if you look at dairy products, it's probably the least healthy food overall, because the dairy is just not good for the intestines. We're just not made to break down those products long term.
Yeah. Okay. I mean, that makes sense. Like, evolutionary.
I mean, I'm all for it. I had ice cream last night, but who knows, in 10 years?
It's all downhill from here. Geez, getting old is horrible. Okay. Are there any other like foods or like common things that people talk about that you think are misnomers, or anything, just off the wall? Like we talked about gluten, we talked about dairy. Like, is there anything else that you think people should be eliminating or incorporating that we're not?
So you already talked about the probiotic stuff, and I'm for that in certain disease processes, or just talking with your doctor. It's kind of complex, so I wouldn't just start it. But if you're on
by the way, this is not medical advice.
if you're on,
we're just talking.
If you're on antibiotics, I do recommend probiotics during that time, and I've done studies on that. Regarding other stuff, like I guess what people are thinking of, like a gut cleanse or juice cleanse.
Yeah, what do you think about those?
Honestly, there's the easy answer from a doctor standpoint for your med school is, run. If you circle that choice, you're expelled from the med school.
Yeah.
But I'm not for it.
Yeah.
But like, honestly, that's something that you need to talk with a doctor, because maybe that just means you're stopping something else.
Right.
So you're substituting, instead of like 6 things of coffee or caffeine and some osmotic that's causing diarrhea, you're taking fruits and some smoothie that's called the juice cleanse.
Right.
So there's more to it.
Yeah.
Instead of just the word juice cleanse. So the jury's out.
Right. Gotcha. Okay. So let's go ahead and switch and talk about, the medical landscape of today and, what you've kind of done over the last year or so in response and your new practice.
Exactly. So I'm young, naive, but I'm not dumb.
Yeah.
I see what's coming. This is from like a doctor standpoint. I see what's coming in healthcare from both clinicians and as a patient, most importantly, because I'm going to be that patient.
Yeah, it's kind of terrifying.
Yeah, exactly. In like 10, 20 years, I'm going to be that patient, or hopefully not tomorrow. Mm-hmm. So I am just tired of that, providing that kind of care, and also being on the other end. Let's say, I have an issue once a year that I got to go enter the medical system for a couple of days. Mm-hmm. It's crazy. Mm-hmm. It's like insane. It's not just, it's a combination of all the red tape and all the stuff you have to do through your insurance and all this stuff to even get any test done. And I'm like a healthy person.
Right. Exactly. So like as a patient, I feel like people are getting horrible customer service,
Correct.
If I feel the same way, like if I need anything done, I reach out to colleagues because it's easier to like phone a friend, which obviously is, a gift that I have that not everyone does, than to try to go the traditional route and make an appointment and get my insurance to approve it and schedule a test when the insurance company says I can schedule it and pick up the prescription, the generic version that they want me to have. Like from a patient standpoint, it's horrible, but tell the listeners about like what it's like being a doctor. I think that's what not everyone hears. They just get the bill that shows that we quote unquote charge them $50,000 for an x-ray. And they think that that's all coming from just the doctor themselves.
It's all true. And it's sad. And from a doctor standpoint, we don't like it because it makes us look bad because you're not happy. And we just want to provide care and, you to be healthy and move on, because moving on means you're getting better.
Yeah.
So it's drawn out. It takes forever to get stuff done. I can't do a good diagnosis or workup because it's so fragmented. It's like, I would recommend a CT scan or an imaging modality or some labs, and then quick follow-up or see another specialist. But by the time this all happens, because of some insurance dictation or the patient's just frustrations, I don't blame him or her. Mm-hmm. It's like 3 months later, either it's fixed or they blew it off and it's gotten worse.
Yeah.
And this is a problem, especially when you get older, like cancers or bad things, not just my head hurts, but maybe the head hurts is a problem.
Yeah.
Maybe there's something underlying.
Yeah.
So I think
there is something underlying.
Correct.
And that's what you and I, like normal functioning human adult doctors, want to find out, but the system doesn't really want you to,
The system does not.
They would prefer that we just give you a pill and you follow up in 6 months and then keep going and chugging along and see more and more patients quickly.
The system is not set up for success, in my opinion. I've seen it. Like I said, I'm young, but I've seen it. And you and I have been through similar years of training over a decade. And it's changed over the last 10 years. And I'm not just saying that because I'm finally in it.
Right.
And my family member, my father's physician, so he's like, this is completely different than when I started.
Yeah.
Like he couldn't even envision what it looks like today. Mm-hmm. So honestly, I need to change it. It has to change somehow. And the only way to change it is do it.
Yeah.
So change it.
So tell us, I just want everybody to know your background. So your dad's a doctor, your brothers are doctors. Like tell the whole story.
My dad's a doctor, internal medicine.
Okay.
So primary care, he's still working. My mom's a nurse. My sister's a nurse practitioner. One of my brothers is finishing his training. He's going to be a dermatologist. So, I mean.
And then you're a gastroenterologist. So we've got like the full gamut here.
My other brother's in business, thank God.
Okay. I would like to say he's the smart one, but you're also the smart one because of what you're about to be doing or what you are doing. So, talk to us about that and like what your vision is and what you've been accomplishing.
So as you've referenced, I've took all those pieces that we're frustrated with as a patient and as a physician and eliminated them. Okay. They're gone. Like, it's not a process. There's not another meeting. I don't have to speak with another staff about it. I just said no. So I started a new company. It's called The Modern Med. It's not called GI Med. It's called The Modern Med for a reason, because I look to expand to other specialties because I think it's everything's related, like your brain and gut.
Exactly.
So psychiatry in the future, GI, who knows? Mm-hmm. So it's GI on demand, concierge GI care, doctor only.
Okay.
So a patient that's interested, I provide 2 platforms, basically on-demand procedures. So as you referenced earlier, endoscopy and colonoscopy.
You don't have to wait for it. Like they could literally call you and be like, I'm having these symptoms. Interview. Yeah, exactly. We'll write down his number. No, we'll give you that at the end. But yeah, so like if someone knows they need a colonoscopy, they're due, they're 50, all the things, they can call you, establish care with you, and basically get that.
Correct. They could literally get it done when they want, where they want, how they want. Now, how do you do this? You're thinking, oh, this is crazy. Well, there's some things you have to eliminate. So I eliminate insurance plans because they are a barrier to medical care. Yeah. I'm not just saying that from a monetary standpoint. I'm saying it from a patient care standpoint, from what you referenced earlier.
Right.
So there's no check network, wait 3 months. When you have rectal bleeding or change in bowel habits, you don't want to wait 3 months.
Yeah. Especially
when you're older. And first of all, I can't sleep at night if something bothers me. And like, I keep thinking about it, and then it relates to your head, which relates to your gut. So it's like a negative feedback loop.
Right.
So that's one part, would be the procedures. On demand, where you want, how you want. Anywhere in Southeast Florida, 5-6 surgery centers over 150-mile radius. I come to you.
Yeah.
So the patient doesn't come to me, I come to you. Yeah. You need it done, we do it. Yeah. At one of those 6 whatever places. And it's a couple-day process. You call me, we set up time in the next week. After you get full screening by me, I do telemedicine care. You don't have to drive across town, park in a structure, deal with traffic. Yeah. To go talk to an assistant or a nurse practitioner instead of a doctor at that time. And you get care follow-up. So I follow up with you. It includes a package. It includes everything. Yeah. And you get these like proprietary care plans with it, extensive literature. It's actually a deal.
Yeah, exactly. I think that's what we take for granted or we don't realize because, maybe you get your health insurance through your work and so you're not paying that much for it. But if you are someone who's paying for your health insurance out of pocket, that is expensive. It's like $500, $600 a month. And it's like, if they just called you and booked their appointment or they set up this, continual care plan with you, you'd save money.
Correct. It's probably $5 during this 1-hour interview for my monthly premium. Yeah. So honestly, I recommend still having insurance. So it's just like your house. This is an analogy. You have insurance on your house for disasters, hurricanes, or something that you can't control. Right. But you spend out-of-pocket cash for renovations and improvements. So just like your health, you're going to spend out-of-pocket cash for your health to maintain and improve it. But if a disaster comes, some crisis, you want to have insurance because you go to the hospital, it cost $50,000 for that visit that you didn't do anything wrong. Right. Like you had an accident driving or something. Yeah. So I recommend insurance, and you can use it for your labs, imaging, test, pathology. It's literally just for the physician fee and the facility fee, all the stuff for this procedure. Right. You pay cash, but guess what? I think I'm the first person in the United States of America to accept Bitcoin for colonoscopy.
Did you hear that, people? He accepts Bitcoin for colonoscopies.
Exactly.
So, listen.
It's true. I honestly, you can go online and pay with Bitcoin. It's so simple. Yeah. And credit card, rack up your miles.
That's true.
But also I provide another service that's just as important or more, would be chronic GI care. Okay. So you can become a member, sort of what you hear like a concierge or direct primary care. I'm offering that for GI. So it's people that have just chronic GI problems or just want a safety net. Yeah. Like honestly, if you do a lot of traveling, like we talked about, that gut is in flux when you travel. It's nice to have somebody on demand because, like I said, proactive versus reactive. Right. So if I spend a couple $1,000 a year to have a doctor available almost 24/7, night times and weekends, that's unlimited visits. Right. And that's licensed in Florida, and I'm licensed in New York.
Exactly, which is like most people here go back and forth. But I feel like the smarter, this is going to sound arrogant, but the smarter people in medicine are doing this. You know, like this is the new way. You're not going to be able to find a reputable physician who is in the old system. You know, like if you really want to be able to trust your doctor, you're going to have to find a way, you know, through Concierge or whatever it may be.
Correct. It's tough. You know, I think in 3 to 5 years, it's going to be the status quo, but it sort of is a status quo based on your demographic area. Let's say in Florida, there's a lot of primary doctors that are doing this.
Yeah, no, here it's like so many of the ones that were on staff at the hospital, let's say when I was in residency, they're now concierge. That's it, period. They don't even like take new insurance patients.
And like we said, this is not like we're catering to some sort of CFO, CEO mentality. No. It's actually catering to a lot of people with high deductible plans too.
Yeah, exactly.
So there's plans out there that cost deductibles annually $5,000 to $9,000. And if you're a normal, even healthier, middle-aged person, you're not going to reach that.
Right.
So if you pay a couple $1,000s for this endoscopy experience total, one, it's like amazing. Mm-hmm. And two, it's the same price or cheaper than what you would in the system.
Right. So with a much less valuable experience.
Much less. So another thing of this model is that it's limited membership. So like I don't have infinity patients.
Right.
It's set.
Yeah.
So then you become on a wait list, and people go on wait lists all the time. Not with me yet, but you know, stay tuned.
Yeah. They will. They will.
So it's common, and honestly, it's allows the doctor to spend so much time with you.
Right.
I'll be able to tell. We'll know each other's first and last name. Mm-hmm. I'll know if you're right-handed, your dog's name. Mm-hmm. Everything.
That's a game changer. And that's what, you know, I mean, now that I've switched over to plastic surgery, that's what we offer our patients, you know, and it's worth it. It's worth that premium. You know, you want to be able to know that the person taking care of you is taking care of you and they actually care and they're actually going to follow up on your blood work or call you back when they say they're going to call you back or answer the phone at night. Like I give all of my patients my cell phone number, period. You know,
that's smart. I mean, you're ahead of the times, especially in the surgical department. I mean, it's the future. It doesn't mean like you're just going to wave a wand and rub some lotion on someone's skin to fix their gallbladder.
Right.
But like stuff's going to get done, but it's also going to get done to prevent you from having problems.
Right. And I mean, the telemedicine aspect of your practice, I think is also really important because it's difficult. Like we're all working, we're all inundated with endless amounts of emails and texts and social media. And it's like, we're just like constantly thrown with information and trying to like schedule something, get there, you know, take the time out of our day off from work, arrange childcare, like having a telemedicine option, super important.
Exactly. Like I said, all those things are eliminated. Literally, you can hit text on my website, comes to my phone. Okay, what do you need? And then literally we can have a meeting within hours.
Yeah.
And where you want, it could be at your parking lot while you're eating lunch at your lunch hour.
Yeah.
And you don't, because we can't afford to miss work these days. Everything's so expensive.
Right.
And I am your average person, so I know.
Yeah.
And your family, like their kids have stuff after school. Like you don't have time to take a half day off to go drive across town, park, to go visit and see an assistant, not even a doctor, for your specialist care.
Right. So let's just ruffle a couple feathers here really quickly and talk about people coming out of training these days. Like, have you noticed the difference from when maybe you and I trained or the people before us versus the kids that are in medical school, you know, in residency? Like, have you noticed?
Of course. They all walk out with the shirt that says Zoom University. Proud graduate.
Yeah.
Honestly, I have noticed. Now, they're smart, but certain aspects. So when it comes to clinical work or workload or on-demand thinking, I feel like some of them lack. Mm-hmm. And this statement is not generalized. It's just a basic observation.
It's a fact. Yeah.
I mean, I have younger brother and in this process, so I know. I mean, granted, he's smart, but he tells me this. So let's just, there you go. He tells me this.
Okay.
I think they realized they got a little complacent during COVID, and now it's kind of a catch-up couple years, especially clinically.
Yeah.
Book smart, they're probably champions. Like, I mean, granted, if you stare at a textbook for 2 years during a pandemic, you know the answers.
Right.
But I think the mentality's there deep down. I feel like it's kind of scary, though, for the future because I don't know if their whole mindset's in it for the long run and able to handle the workload and demand.
Exactly.
Because they just want to stay behind the scenes and say they're a doctor and maybe
be
not
an Instagram doctor.
Correct.
You know, make TikToks, all the things. But also to your point, they're very good at reading, answering test questions, but working is a different story, like actually doing the day-to-day grind, working the long hours, taking the call shifts. Unfortunately, I've seen so many people come out of training right now who cannot fathom the idea that they may have to work past 5 p.m. Like, how are we going to be taken care of as adults? As we get older, there's going to be no one there.
It's a fact. And the thing is, they have the audacity to just tell their staff or their superiors or their attendings, I don't want to.
Yeah.
If somebody said that to me like 3 years ago and I was an employer, I'd be like, you're fired.
Yeah.
But now they can't do that because they know they have leverage.
Yeah.
Because the job market.
Mm-hmm. Right.
So they know they have leverage. They can do that. It's scary. It's a scary time to be an employer or just in the healthcare field, especially the future, because we need the care in the hospital and out of the hospital.
Right.
And that extra hour that they spend on their social media, which is great, it's an adjunct. Imagine if that hour was spent seeing patients.
Right.
Or an actual experience.
Doing a procedure.
Correct.
Watching someone else do a procedure. I'm in a surgical field, so that's how I look at things. Like, the more exposure, the more things you're going to learn and the better you're going to be. And if you're just not putting in the hours, you're not going to get there.
I think literally the best person in medical training nowadays is someone that has the best work ethic.
Yeah.
It's not the smartest person like in the textbook per se.
Right.
It's someone that literally just wants to work.
Right.
It doesn't mean wanting to work doesn't mean 80 hours a week. It just means working hard while you're working.
Right. You can work smart.
Correct.
But you still have to do it.
Correct. Like you and I are doing.
You have to be accountable. You have to follow through. I literally saw a text conversation with one of my colleagues he's a surgical oncologist and one of the residents. And he was just trying to follow up on something. He's running between 4 different hospitals, also running a clinic. And the resident at the hospital was supposed to follow up on an IR procedure. And she's like, oh, I'm sorry. I went home for the day. I was post-call. Yep. I'll look tomorrow. Like, you'll look tomorrow. That patient in the hospital doesn't want you to look tomorrow. They would prefer if you could just take 5 minutes to make a phone call and find out what the status is. Like, this is the difference in the people that are training now and the people that trained before. And it's just scary. Obviously, there are going to be outliers. And obviously, there are good people still. But, I've seen a bad trend.
The trend is there. We could talk on it forever. Honestly, I have so many examples. I can write books on this, textbooks, and never ending ones.
Right.
But like you said, it's scary. It needs to be fixed. And it takes people like us to do it because you just got to think differently. So that's why I'm doing my group like how I am right now, because I want to provide better care. And in order to do that, I have to do X, Y, and Z.
Right. That's important. That's why I brought that up, because you want to be able to find someone who still cares. I think the general consensus is that doctors don't care. They're just there for their paycheck. Like, we hear that all the time, but there are still people who want to do good and who have that mindset and who are building practices that welcome you and will take care of you. So that's the modern med.
Exactly. That's the goal.
Yeah. Okay, good. So I think we exhausted that topic. Let's talk about some more fun stuff. You have some books coming out, books plural. I mean, what do you not do? Like, I was scrolling through your CV. You've opened several businesses, you've done multiple practices at this point, and you're not even that old. And you're also just constantly cranking out literature. So tell us about the books.
Yeah, I think it's good to have some side hobbies that don't distract from you don't do this while you're, sitting in the back of the ER waiting for someone to go in AFib.
Right.
But yeah, it's just basic stuff that's relatable. Like I said, I like treating common stuff or talking about common things. So my dad and I wrote a book that's going to be launching shortly. Doctor's Guide to Pickleball Injuries. Why? Because pickleball is the most rising sport. 2, it's because we play it. And 3, there's nothing out there on it.
Yeah.
And he sees injuries all the time as a primary doctor. So I'd rather have something.
Crazy.
So we just wrote it together, and it's just something relatable.
Yeah.
I mean, I'm a GI doctor and he's a general. So yeah, maybe it's better written by an orthopedic or sports med, but then why didn't they just do it? But they didn't. Because
they didn't. I love that. You always find that opportunity and literally take it. And that's awesome.
You go on Amazon, you look, is it there? No, you do it.
Nice. So how long is it? Is it a quick read, or is
it's
it something?
A basic read, 150 pages. So it's kind of on the shorter end, but includes pictures and demonstrations, and it's not that expensive. And it's a good gift
Yeah.
It's like for your parents, I mean, a guide to prevention and treatment.
Yeah.
So we know a lot of stuff because we're medical, but the average person doesn't.
Right.
And I see people like have problems all the time when they play.
Yeah.
And maybe if they read chapter 3, it'd be okay.
Yeah. Okay. So you play pickleball now.
Yeah. I mean, I'm not good, but I'm not bad.
Did you ever play tennis before?
No, that's the problem. If you play tennis first, cakewalk.
See, I need to go play pickleball. I played tennis in high school.
Oh, then you're good.
I wasn't that good. I was better at wearing the outfits. But but I want to try it. Nick, my husband, has played it several times. He loves it.
Oh, yeah.
He's played in Alton too. You guys should play.
Yeah, so it's like, it's good so it's great because everyone plays doubles.
Yeah.
So then you don't have to have the pressure playing singles, which is more workout.
Yeah.
So doubles is easy.
Yeah.
It's like flicking your wrist, but really not really.
Yeah.
So
but you could still injure yourself, which is why you need the book.
Correct. And it's good. It's like co-ed. Even the professionals have co-ed teams.
Really?
So it's very socially made. There's like, if you look at Major League Pickleball, it's on like ESPN.
Yeah. I know. That's what's crazy. And who was it? There was like a professional tennis player who now is like doing professional pickleball.
Good. I mean, the times change. It's like, you have to adjust and be dynamic. If tennis is great, but like pickleball is rising.
Yeah.
There's other stuff too, like paddle or racket, but like pickleball is so easy. It's relatable. So that's why people like relatable things.
Yeah.
Your average 50, 60-year-old female and
they're
male,
all playing.
They're all playing because
they're literally all playing.
And it's a cult.
Yeah.
These people don't leave the courts. These people don't leave the courts. There's lightning like a mile away.
Yeah.
But they're the same people that there's lightning a mile away from the kid's baseball game. They're like already driving their kid away.
Yeah.
So it's a straight up cult and they don't leave the court. And these people are like not in the best shape. So I'm just like, how are they doing it?
I know, but don't you think it's really good for them?
It is good.
Yeah. I think like out of the pandemic, we got pickleball.
I'll take it.
Right.
Step 1.
Okay. And then tell us about your other book.
Other book is I'm writing a book currently right now in process on just concierge medicine and like why you need it as a patient, both like yesterday, now, and tomorrow. Like you need it now. And you're thinking, saying that because you want to say, no.
I know. People are going to think this was totally just a promo podcast, but it's not. This is really how we feel.
That's not even the name of the book. I don't even have a name.
Okay.
If you think of the name and get it right, you get free whatever copies, whatever you want. But it's just, as a patient, like, they don't know.
Yeah.
If you go to different demographics, I'm from Wisconsin, they don't know how to spell concierge. And it's not like a literacy thing. They're smart people. It's like the best school system.
Yeah.
It's just they're not exposed.
Right.
And some people think it just means like you're catering to some CFO of Lockheed Martin. No.
Right.
Like I'm catering to someone that doesn't even have health insurance because they can't afford health insurance.
Right.
Or the deductible is $10,000.
Exactly. Like one of my recent health insurance policies, the deductible was so high. I literally was paying for everything out of pocket anyways. Like, it's like, when is this going to kick in? What am I paying for every month?
Or the opportunity cost of leaving work that extra day that's not covered to go to a doctor's appointment.
Right.
That would literally pay half your membership with me in one day.
Yeah. Right. There you go. Okay. So let's just kind of regroup. So the Modern Med is here. It started. It's going to be expanding. People can find that at themodernmed.com. Where else do you want them to be able to find you?
Basic social medias are on there too. I work with and will work with more primary doctors and concierge and direct primary care doctors literally across the state of Florida. I envision patients coming from across the state for procedures over here because it's quicker than waiting 3 months. Yeah. And it's an excuse for them to like see their family on this side anyway.
Right.
They can find me anywhere. The website has everything. You literally hit the button text. It comes to the doctor's phone. Yeah. It says no one ever.
Game changer.
Yeah.
Game changer. Good. Okay. Well, I really, really enjoyed our conversation today. I thought this was good. Like I said, we're probably going to ruffle we're going to get hate mail from medical students for sure. Yeah. But that's fine. The good ones. I don't have any
students on my rotation currently, so we're good.
Neither do I. Hopefully we don't get too much hate mail. But I really appreciate you coming on today. I want everyone to follow The Modern Med on Instagram. Look at the Modern Med website. Of course, I'm at Slimming Surgeon. Send us some DMs, send us messages with thoughts, questions, but most importantly, subscribe to the podcast, leave us a 5-star review, and make sure you come back next week. Perfect. Thank you.
Thanks for having me.